Voting is one of our most cherished rights in the United States. With this great right comes great responsibility. When we choose a president, we need to take time to learn the candidates' positions on the challenges that face our nation. And there's no greater challenge than providing access to health care for our citizens. Today, many Americans cannot afford health insurance. The Census Bureau estimates that 16% of our population, nearly 50 million people, were uninsured at last count. And without health insurance, it's much more difficult and expensive to get medical care. Most of us have health insurance through our jobs, or if we're eligible for Medicare or Medicaid. But if your employer doesn't provide insurance, or if you're unemployed and you have a pre-existing condition, such as cancer or diabetes, you could be out of luck. That's the problem President Obama was trying to solve with the Affordable Care Act of 2010. And when the Supreme Court upheld the law earlier this year, the door was open for millions of Americans to be able to buy health insurance. But sadly, many people are misinformed about the Affordable Care Act. A recent survey showed that only about half of those surveyed knew what the Supreme Court had ruled. About a third didn't know, 15% answered incorrectly. So, before you go to the polls in November, learn the facts about the Affordable Care Act. You may decide to oppose it. That's your right. But make sure you know what it does and does not do. First, it will require most Americans to buy health insurance or pay a penalty if they don't. This is meant to encourage everyone, the healthy and the sick, to get coverage. It's a bit like Medicare and Social Security. All of us pay taxes to support these programs when we're working so that we can benefit from them when we retire. Little will change for people who already have health insurance through their jobs, Medicare or Medicaid. Second, insurance companies will no longer be able to deny coverage or overcharge people who have pre-existing conditions. This will make health insurance more affordable for those who need it most. Third, the ACA will establish health insurance exchanges for people whose employers do not provide health insurance. Low and middle income families will receive subsidies to help pay insurance premiums and reduce out-of-pocket costs. Benefits will be standardized so that persons who need coverage can more easily select the health plan that best meets their needs. And fourth, the Affordable Care Act allows states to expand eligibility for the Medicaid program to all persons with incomes near or below the poverty line. States can choose whether to participate in this expansion. This law represents a major step toward reducing the number of uninsured Americans who now go to the emergency room for what are often minor or preventable problems. Some people say the law goes too far, that we should just leave healthcare to the free market. That's essentially what we do now, and it isn't working very well. Others say the law doesn't go far enough, that what we really need is Medicare for all or some other single-payer system. To them I say, you're right. I'm a public health professional, and that's what I would have preferred. So yes, the Affordable Care Act isn't perfect, but it is a lot better than what we have now. When you vote in November, you don't get to pick the candidate with the perfect plan. She doesn't exist. You do have the opportunity to re-elect a president who has made a valiant effort to solve a major problem, or elect a challenger who has vowed to repeal a plan that is a lot like the one he signed into law when he was governor of Massachusetts. It's your choice. Do your homework and choose with care. I'm Janet Coffman.